Hunter syndrome is a progressive, multi-system disease that requires really ongoing patient care. These patients are progressive disorders. It's not a static disorder. There are many different organ systems involved, so it's important to really get your colleagues, your multi-specialty colleagues involved in these patient care for really the best outcome. Virtually every system involved, therapy is beneficial, but it's not a cure. We don't cure these patients, we manage them. And so I have this tool that I use. I basically start from the head and go down to the toes and talk about CNS issues, neurology, ENT, talk about hearing, go over ophthalmology or eye, talk about dental issues, pulmonary, cardiac, the orthopedics, talk about physical therapy and occupational therapy, and then I'll talk about general issues. To really take care of these children well, you really need a multidisciplinary team. And that's really for the care and management with a diverse set of providers. You have lots of different people you need to bring in to really take care of some very difficult management issues in this population raises. The challenge is they're not very common. Most people have not seen these. Even some specialists a lot of times have not seen these patients. The more you can get an experienced person in your institution involved. For example, in my institution, there's many different cardiologists and many different pulmonologists, but I have one or two people that I typically have see these patients that have built up their expertise and really then enhances the patient care, enhances my understanding of how to take care of these patients. And so that's the advantage of this team, where you can actually enhance the knowledge of your subspecialty colleagues because by seeing these patients, you actually can learn more, and the patients teach the subspecialist and vice versa. It's also very true that the last statement here, best practice guidelines are often lacking in care. It's not always clear how to manage some of the complex problems we see, and you have to be innovative, and that's why it's so important to have colleagues who have seen the disorder, who have a little more knowledge of it than others, but who have significant knowledge of their particular specialty. There are really these challenges for the healthcare team because these disorders are rare and complex. You can create new individual patient-centered solutions to these difficult management. You can really help advance science at the same time. It's important to try to develop these solutions and adopt new practices to really enhance these patient care for these very difficult and challenging issues. So one of the ways to do this is to really develop this so-called multidisciplinary team to really help manage the patients where people interact over the care of these patients. They don't have to be physically in one place. In my university, I basically have this set up where I have every subspecialty colleagues identified. I'll typically talk to these colleagues and help them say, here is the problem I'm looking at, can you help solve this with me? And that really dramatically improves the care of these patients. So what does it look like if you had to set this up? It's really a team that comprises all healthcare professionals across the spectrum. They share a common goal of providing increased patient care and optimal care, and they do this through continued management and, more importantly, for communication. They talk to each other and they interact, and everybody learns. And clearly one of the challenges is end-of-life care, this hospice care, that can be really helped if you have people involved who can help you deal with these complex issues of these patients. The patients and the families need to be part of this team to ensure their adherence. They need to be involved. And most of the families are involved because they realize that their general pediatrician, their primary care provider, really cannot help them very much. They really need the subspecialty patient to really enhance their care. It's like any issue in healthcare these days is to really interact and communicate. If you don't talk to your colleagues and not sure what they're doing and they're not aware of what you're doing, you really don't get the best care. So that interaction is so crucial. So everybody knows what's going on, so you know what tests are presented, because I try to take advantage of anesthesia and sometimes schedule 2 or 3 things with one anesthesia. I may put in hearing tubes and do a auditory evoked potentials under anesthesia, or I might do hearing and an LP if I'm concerned about hydrocephalus. So I take advantage of this. The only way I can do that is by knowing what other people would like to have done in terms of care of these patients. One of the challenges is to find a person who can really coordinate that care. That can be a lot of different people, but who's really the focal point for that family and who allows that patient and the parents to really interact with, and who also knows all the other people in the team. If you could meet once a month and talk about your care. I know the airway group in my institution really does that. They have a conference once a month and talk about all the complicated airway, and they have neurology and they have sleep and they have pulmonary and cardiology all meet. And that's the concept. It's a challenging one, but if you can do it, it's phenomenal. That care coordinator could be almost anybody. It could be a advanced nurse practitioner, it could be a genetic counselor, it could be, other healthcare primary physicians, it could be yourself, or it could be a pediatrician. So it needs somebody to do that coordination who understands the family, understands the disease, and who can make sure patients get to their appropriate clinic visits and that. And just in terms of Hunter syndrome, there is this guideline now from the Hunter Syndrome European Expert Council. Certainly Dr. Scarpa was a lead author in this. Other people in the room were involved in this publication. It's a great resource to have in terms of how to manage your patients with MPS II.